Pregnancy is an exciting time for a couple. It's a new changes happening. It's a very happy time, but although there are these exciting new changes happening, a pregnancy can bring some questions and concerns throughout the course of the pregnancy that may cause couples some anxiety or make them feel scared. So we, the OBGYNs, can help a couple guide them through this journey of pregnancy. During the first trimester, women may experience lots of different changes. One of them is sensation of nausea. Nausea can be quite debilitating because it makes you eat a little less and not feel so good. We do help women out by suggesting they eat small, frequent meals, keep crackers by the bedside, sometimes incorporating ginger and peppermint to help with that. Because of the nausea, a lot of times women do not gain a lot of weight during the first trimester. Throughout the pregnancy, we do anticipate a weight gain normally of between 25 and 35 pounds, but during the first trimester, because you're not feeling so well, sometimes women are not eating so much and may actually lose a little weight and not gain so much weight. But then after the first trimester, that should change and women start gaining weight. Another symptom women notice during the first trimester is tiredness. Part of it sometimes is because they're feeling nauseous and not feeling so well, but that tired feeling gives them a sensation of low energy and they just kind of don't feel like doing the same things they used to do. That again usually gets better later on in pregnancy. Women also may notice some cramping and bleeding throughout the first trimester, which can be alarming to them, and we do address that with them. If they have any questions or concerns, we can always make sure everything is okay and let them know when it becomes something that we need to address versus something that we could just watch. If a woman is active before she's pregnant, then it does help make the pregnancy easier, and being active, exercising, does help manage some of the symptoms that you're feeling, during the pregnancy. Also helps a little bit with delivery if you're a little bit more fit, so that's another bonus as well. Most important thing is not smoking. In general, it's good not to smoke, but especially for the pregnancy, it doesn't just affect you and your body, but it's affecting your baby as well. So that's probably the biggest thing someone can do, is not smoke. Eating healthy is just good because I think it gives you more energy, and you're feeding your body and helping, meet the demands of a growing pregnancy. Also, during the first trimester, there will be many other symptoms you may or may not experience, but we are here to help guide you through this incredible journey. During the second trimester, a woman starts to feel a little bit better, the energy picks up, the nausea usually has gone away, but some of the changes she starts to notice is as the pregnancy progresses, the uterus gets bigger, the baby starts growing, and she may notice those changes throughout her body. She starts gaining more weight, she may start noticing the uterus or her belly getting bigger and protruding. A lot of times that can cause problems or pains, like with her muscles or her ligaments and just the bones kind of moving around. So that is a little uncomfortable time, and we can help her through that part of the pregnancy by recommending some stretching exercises. Exercising actually also helps as well. Activities like swimming is also great for a woman's body. During the second trimester, there's something called round ligament pain, closer to about 18 or 20 weeks, that a woman may experience, where it's kind of a little cramping sensation on one side that really is just a sign that the uterus is getting bigger and stretching, but that can be scary to someone, so we can help reassure her. Also, during the second trimester, one of the exciting changes that happen is you start to feel your baby move for the first time, which is a great sensation, but sometimes can cause a little discomfort as well. One question that a lot of patients are worried about are development of stretch marks. As your body gets bigger and starts gaining weight, a woman can develop some stretch marks, and that is a concern. Unfortunately, there's not much we can do to prevent stretch marks from happening, but we do recommend some creams and stuff that a patient can use to help her with that process. During the third trimester of pregnancy, it's a very exciting time. You're approaching delivery and meeting your little bundle of joy. You'll be seeing us, your physician, closer together as well. We start seeing each other every 2 weeks initially, and then every week. Also during the third trimester, your baby starts to gain half a pound a week, which is a very exciting time because during the third trimester is when your baby's really going to start growing. But because you are gaining a little bit more weight during the third trimester, that can cause a little bit more discomfort, and that's okay. Women also feel a little bit more sensation of pressure, may start developing some contractions or Braxton Hicks false labor, which can seem scary at times, but something that is normal, and we can help you through that process. It's just important to stay focused about what's coming up ahead, the day of delivery and meeting your bundle of joy. as you approach the delivery day, it's normal also to experience more anxiety and stress about the whole process, because this is a time of big changes that are happening and, stressful things that could be happening. So we also encourage you to take childbirth classes, and during the 3rd trimester it's a good time to take these classes because they can help you through the process of labor and delivery. And it's important that you let us know how you're feeling so we can help address these fears or any questions that you have and make this journey easier for you. An average pregnancy can last up to 40 weeks, and during this time it's important that you develop a positive and, more importantly, comfortable relationship with your physician. A lot of questions and changes arise during the pregnancy, and we want you to feel comfortable asking those questions so we can help guide you and reassure you during those times. We want to be able to share into this exciting journey with you and help you through the process. Some general questions I get asked during, especially a first visit, a lot of times is exercise. A woman asks, can I keep up my same routine? And definitely, if that's something they've been doing, exercise is a great thing to continue. If someone is wanting to start an exercise program, we'd probably talk about maybe, starting slow and building, working up to whatever level she's comfortable with. Another question that couples ask also is about intimacy. So that's something that we address, and it's fine to be intimate throughout a pregnancy, but it does cause some concerns, more probably for the pregnant patient than the husband or partner. But it's something that is definitely a real question. It's part of life, and we're happy to address that. It's not always the easiest thing to ask, but it's definitely something that is asked during the first couple visits. I love being an OBGYN because I like the relationship I develop with a patient, being able to be there from the beginning of a pregnancy through the delivery, meeting the patient's new addition to their family that they've been waiting so long to meet. I also it's not only taking care of pregnant patients, but also after having a baby. There are other issues, routine care that a woman needs, and I want to be there to help her throughout all process of her life, or all aspects of her life.